Hi, my name is Tara Clark, and I am in the Family Nurse Practitioner program. This presentation is on how technology and its applications with internet-based self-management can improve asthma control and quality of life. Asthma is a chronic respiratory disease with acute exacerbations that can be crippling and negatively impact a person's ability to fully function in daily activities. Asthma is the most common chronic illness in children and affects more than 235 million people worldwide. Self-management is a key to managing chronic illnesses, especially ones such as asthma. Self-management decreases the frequency of exacerbations and allows a person to fully live their life. With the current and upcoming changes to healthcare, innovative methods for the self-management of chronic illnesses becomes even more imperative. One method of self-management is using a web-based application to encourage daily self-management, as well as providing social and clinical support. Asthma is an excellent platform to test and demonstrate the possibilities of this intervention. 4 different randomized controlled trials were reviewed for their use and applicability of internet-based self-management programs. These studies use these programs as an intervention to evaluate its effect on asthma control and quality of life. The studies all implemented these programs and encouraged participants to use things such as an online journal, track their daily forced expiratory volume, and even provided clinical and social support. The studies all use varied populations, such as Vandermeer et al. Used adults, but Joseph et al. Focused on urban teenagers. All the studies showed at least some statistically significant data in favor of this intervention. Though all the studies showed some effect after 12 months, it was the study by Rickers-Mutarts et al. That portrayed that without consistent clinical and social support, the effects of this intervention dwindle over a length of time. They noted there was more statistically significant differences at 3 months than there were at 12 months. When evaluating the total effects of studies reviewed, it is clear that there is a promise in the use of technology for self-management of chronic illnesses. Each of the studies reviewed has statistically relevant information to allow other researchers to pursue this area as a plausible method for future inquiry and applicability. One of the core components of nursing is health promotion and education. Internet-based self-management is another tool nurses and healthcare providers can use to assist their patients in managing chronic illnesses. The intervention proposed is to use a web or mobile-based application as a foundation for those suffering from asthma to get clinical support, support from their peers, education regarding symptoms and triggers, as well as a way to monitor their progression within the disease itself. Like in the studies reviewed, questionnaires would be used to measure the effectiveness and even maybe the perceived effectiveness of this intervention as a way to increase asthma control. When considering the most appropriate healthcare environment to implement this intervention, there are multiple factors to be considered. The first is urban versus rural. Most of the studies conducted regarding this intervention take place in urban areas where poverty levels are low and the incidence of asthma is high. However, in rural Kentucky, asthma is still prevalent. That is why I propose a rural setting for this intervention. The second is pediatric versus family. Either pediatric or family practices would be acceptable places to start, but like Gustafson et al., I believe that the best way would be to incorporate the parents as well as the child into the education and management process if focused on pediatrics. That is why I believe it would be more efficient to trial this method with participants from family practices first. The last decision is new diagnosis versus poorly controlled asthma. Though over 235 million people worldwide have asthma, the occurrence of newly diagnosed asthmatic patients in rural Kentucky in family practices would not be high enough to create a study with enough statistical power. However, there is a much larger number of those with poorly controlled asthma, which allows this intervention to be an alternate method to be tried to increase and promote self-management. Self-management is critical to any chronic disease, and discovering and implementing new ways to improve and increase interest and adherence is important to the wellness of our patients and to the healthcare system as a whole. Thank you.